drop it in the chat. We'll be saving through to get these questions and tackle them as we move along with the conversation, right? And also, let's note that EHA Clinics, in its magnanimity, thinks it or deems it necessary and appropriate to give a bit of discount, and just as an incentive for men during this particular period, right? Especially for participants on this call. So feel free to drop your chat as we take record of all those. So back to you, Dr. Poi. And my next question for you would be, just assuming someone in their 30s, 40s, and 50s walks into a clinic, say EHA Clinics, right, tomorrow, and says, what are the non-negotiable checks that you would recommend as a seasoned family physician who has seen all this trend of illness plague men over time? What would you recommend?
All right, so great. So I think we'll roll back. So when we say aging, if we ask you, when does aging start? Many people will have varied answers. Some people will say, okay, when you're in your 50s, when you're in your 40s, when you're in your 70s. But actually, aging starts from your 30s. So once you hit 30, you've already started aging. Your bones have started aging, your body organs have started aging. So when we talk about health first, so let's just understand it. By the books, what is health? Health is a complete state of physical, mental, and social well-being, and not just merely the absence of disease. So you could be free from a disease. A disease is something that is diagnosed. You have symptoms, and then it's diagnosed as a disease. You might be having symptoms, but it may not be diagnosed. It doesn't mean you don't have a disease. So you not having a disease doesn't mean you're healthy, because you might have some symptoms. And then looking at these three dimensions, physical, mental, and social, those are the three major dimensions that, as a man, you must take care of those dimensions. And those are where the routine checks, your annual health checks, are streamlined to. There are two other dimensions that also contribute to your health. So when we talk about economic and spiritual dimension, but however, those ones contribute indirectly to the mental dimension of health. So look at these three dimensions: physical, mental, social. So from your 30s, 40s, there are also some tests that when we go to the hospitals, everybody is expected to do. And there are some that is expected that probably maybe the older you get, maybe from your 40s and your 50s, you do those particular ones. And there are others that you may do them younger, at a younger age, probably because you have a higher risk. Maybe you have a family history of those kind of disorders, so you have to do those ones at a younger age. So however, if you're looking at these three dimensions, so we look at the physical now. So when you go to the physical for your annual health check, so one thing that you've been hearing annual. So it's something that should become a habit. Every man should have that as a habit. Every year, do your annual health check. Every year, do your annual health check. You can tie it around a month. That's probably maybe your wedding anniversary, your birthday, or something. Just tie it around a month, a significant month that will make you remember. Every year, do your annual. You ask a lot of people, apart from facilities that have a culture of doing your annual health checks and preventive health care. And that is one thing that if you ask some people, are they sick, everything will carry make they go do annual health check. But it's something that you need to pick a disease before it becomes a disease. So you need to screen so that you prevent complications from the disease. So looking at your annual, the physical dimension. So for everybody that goes to a hospital, there are some tests that you're expected to do. Everybody. One of them is called a complete blood count. So that just checks your blood cells, your white blood cells that fight infections, and some other little cells there. So you must do a complete blood count. You must check your kidneys. So you must do a kidney function test. even in the kidney function test, there are some other micro things under it. But once you order for a kidney function test, of course, the healthcare provider will be there to interpret it for you. You must do a liver function test, and that's to check, the work of your liver. Your liver essentially, what it does is that it detoxifies and excretes the bad things that our body don't need. So you must do a liver function test. You must do a thyroid function test. So that's called TFT. Sometimes you can have thyroid disorders that come down with bizarre symptoms, and if you don't have people that are able to pick up those symptoms, you will never know. There are many things. If you start listing it, probably maybe some people that on the call might have those kind of things, but you must do a thyroid function test. And then you must do a urinalysis. So a urine analysis is just a spot test. It also picks some things that may be in your urine without you knowing. So it's good for you to do that. You can also do a stool microscopy. The stool microscopy just looks at, your stool to pick up, if there are worms or if there are other things. You can see a lot of things in stool, blood, parasites, worms, and all those kind of things. So you must do that as well. And then you must do your fasting blood sugar. So you either do your fasting blood sugar, or there's another test, it's called it glycated hemoglobin. So that's all those ones. The aim is to just see how your body handles, sugar, either as a spot test or over a long period of time. So the glycated hemoglobin helps you to, know how your body has handled sugar over the past 3 months. And then some other tests are age specific. So you do a fecal occult blood. So fecal means stool. So let's just say stool blood. So fecal occult blood means blood in stool, which is not seen. You might not see the importance. So from your 40s and 50s, make sure as part of your annuals, you do a fecal occult blood. Sometimes when you have some polyps, so just some little growths in your intestines and all that, they start dropping some blood into your stool. So that fecal occult blood is able to pick that up. When it picks that, then you go on. It's a form of a screening test. So once that is picked up, then you go and do another test. It's called a colonoscopy, so that if you have any polyps or anything, it will be removed, because it's those polyps that usually lead to some of them developing to cancer of the colon and all that. Which other one again? Okay, so still from your 40s, 50s, you also do an ECG. So an ECG checks, your heart, checks how it beats, checks the rhythm, and just make sure that your heart is fine. For the women, they do a mammogram. So you either do a breast ultrasound scan or you do a mammogram. And that's just to pick up lumps. If there's any lump in your breast or there's anything that can turn into a cancer in years to come, you'll be able to pick that quickly. So that's part of the physical. And then physical notwithstanding, you also have to do your eye checks, because a lot of people have problem with their vision. In fact, me that I will give myself as an example. For many years, I used to use glasses in my primary school, but you know how we are now. So we just left it, and I assumed I was seeing very well. I assumed I was seeing well because I was actually seeing well and I could read things far. But then sometimes I'll be feeling as if there's sand in my eye, or why is this light? Why is this scattering? But I never thought there was anything wrong with my eye, because I could see near and I could see far. Lo and behold, I had my annual health check in AHA clinics, and I was told that I had astigmatism. And in fact, when I was having my refraction, when they changed the lenses, I was like, what? Is this how people have been seeing and have been assuming my eyes? So, if you never had that annual health check, if I never had that and I was just assuming I'm fine, I'm seeing very well, I would never have picked that up. And the lenses I'm using, I'm seeing very, very well. There's less strain, less headaches and all that. And then you must also have your dental check. Dental clinics are where people always run away from because of, let me not call it perceived, but it's true, because of pain. When they put those things in your mouth, and then they will say, we do this procedure now for people without giving injection. They'll be telling you those kind of things without giving painkiller. What is actually, so that's one of the reasons why a lot of people run away from dental clinics. But it's something that is very, very important. Have your dental checks. So if you have dental caries or plaques or all that, they will be taken care of before it becomes very, very complicated. What else am I missing something? I think my mind is telling me I'm missing one test. Then, still part of the physical anyway. Please, I'll soon round up. Victor, sorry, I'll soon round up. So, any good facility you go to, they must do as. So, we're still looking at the physical dimension. Any good facility you go to, they must do your vital signs. So, vital signs are your blood pressure, your pulse rate, your respiratory rate. Those usual things. Any good facility, so you must have those things checked because you always need to know your blood pressure. Yeah.
Thank you so much, Dr. Pui. I don't know if it's my internet
Yes.
or
So we leave the physical dimension. We go to some pre-assessments. If you come to HA clinics, people always come in that. So you must have your pre-assessments. So they usually do a mental health checks. And that mental health checks, there are screenings for anxiety disorders, for depression, for substance use. So any good facility should be able to do that so that when people come into your facility, you as a care provider, you don't miss a chance of picking up somebody that has one of these conditions. And then for the social dimension, it's just social connectedness. Many of us work. We don't take time off. We don't have social connections. We don't have hobbies. Our life is in the office. Our life ends in the office. So you must be connected to your family. You must be connected. Socially, have some hobbies, activities that you do, and all those dimensions. When you add, you can strive to have 100%. Thank you. Over to you, Dr. Victor.
Thank you so much, Dr. Pui. That was super comprehensive. How were you able to compress that into this very short period of time? So I'm sure people are well enriched and they know what to look out for. Yeah. So guys, from head to toe, we look at everything from your eyes to your teeth to your heart to your kidneys to your prostate, everything. We are there for you. So it's coming and we're going to have a total look at your body and we would prefer solutions to any issues. Hopefully not. Sorry, BBT. Quickly, I would like to know that one health decision that you've been able to make now that you wish that you had made sooner.
If you permit me, before I answer that question, when Dr. Pui was speaking, I was talking about, he went for eye check. I think my own experience is exactly the same. Right? It was like day and night. I'd always lived in denial because I could read from afar, In fact, I was testing my eyes by myself. I'd be going on the road and reading signposts from afar just to confirm to myself that, yes, I could see very well. Until I went for, my refraction, I was told, it was similar to his astigmatism. And then they put the thing there and I'm like, wait, what is this? It was like watching those, seeing through the lens of those old television and the latest LED, TVs we had now. So I guess now my glasses has become a partner that, I can't do away with. So I can relate, and I believe a lot more people should actually take the time. I mean, checking your health is really key. And that will lead me to the question you asked, right? So the health decision I wish I had made sooner was treating preventive health, as non-negotiable part of my schedule, rather than something I'll get to when I had the time. For years, my thought has been, when you have headache or you are having high body temperature, you're feeling feverish, that's when you go to the hospital or go to the clinic. I'd always believed that the much work that I do day to day in my normal, activities, that was enough for me. I'd always believed when I'm thirsty is when I drink water. In fact, I've also always believed when I'm hungry is when I eat. And in fact, that it is what I see that I eat. My wife jokingly one time was asking me, what would you like to eat? And I said, anything. She was asking me, wait, is your tummy a dustbin that you want to eat anything? And that thing got at me like, wait, my tummy is not dustbin. So preventive health, now I take it as, non-negotiable. I am very, very particular about, my annual health check. I'm very, very particular about my numbers. In fact, I make record of my BPs, and I take it at least minimum 3 times in a week. I check my BP and I write it down to also follow the trend. When I go for my annual health check, I share it with my physician. The beautiful thing, and I encourage everyone to get on EHA Clinics membership, is in EHA Clinics, because I'm part of the EHA Clinics, membership subscription. I get calls on a regular basis asking me about my numbers. In fact, what I did now is I gave access to the medical, personnel in the clinic, because I have the trust in them, right? Now I take my work minimum 4 times, a week, and I realized it makes me more refreshed. In fact, it opens up my mind. The time when I'm taking the walk, ideas come in my mind. So that's one thing I wish I'd done earlier. But as they say, the best time was yesterday. The next best time is like today. So if someone had not made the decision, prior to now, the next best time is like now, right? So that's one thing I've learned. I've also learned that in leadership, health is wealth. So whatever it is that you think you're trying to make, the reality is you can only make them when you are healthy. So it has helped me to prioritize my health. I'll stop there so as not to take more of our time.
Thank you so much, BBT. I think we're enjoying that, and we're getting carried away. But thank you for sharing your thoughts. It oozes with experience. And yeah, so looking through the chat and our question box, we have a couple. And I think I would have to, who's going to take this now? Okay, Dr. Poi, right. Just to ask, right, for someone is asking, for those of us who hate hospitals or are scared of what might be found out, how do we get past the fear? Dr. Poi, please, can you help this person get past this fear?
In fact, and that's an opinion that a lot of people share. But the truth is, you can't keep on running away from reality. That's just, no matter how you run, no matter how you don't want something to be known, it doesn't take away the fact that that process is still going on. So why don't you just know what's going on, and then you stop it from progressing? I think the best thing is, sometimes we say, as long as you don't see something, it's not happening. It's just like an ostrich that when he's running, it will dig the ground and then put his head under, and then just assume that since his head is under and he's not seeing anything that's happening, there's nothing that is happening again. So just take that bold step. Just go, whatever it is, just let it be known, and then use. It's better for you to go to the facility, to the hospital, and have a clean bill of health and know that you're healthy, and then you continue working towards maintaining, that your health, than you not just going and just assuming that all is well. And then meanwhile, there would have been something that if it was picked early, they would have taken care of it. So for example, there are people don't just come down with diabetes just like that. Except that we were talking about type 2 diabetes, there are different types of diabetes, but the one that is common that is say in adults, people don't just, it's something that sometimes, it goes on gradually and gradually and gradually. Same with the complications. Had it been these people decided to do their annual health checks 10 years ago, perhaps they wouldn't have come down with diabetes, perhaps they wouldn't have come down with the complications of diabetes. And perhaps they had the same thinking that, oh, let me not go to the hospital, let them not find something. But if you just take the bold step, go and have your annuals, whatever it is, we deal with it, and then we move forward.
Thank you so much, Dr. Poi, for that succinct answer. Take the bold step, go in there. You don't really need to be expectant. All you're going to do is definitely to go check whether you're fine. And if you're not okay, how can we start remedying things? Of course, BBT said that the best time to have done it was yesterday, and the next best time is now. So why don't you just take that step? Right. So someone is asking, at what age should men start taking screening seriously? I think we've mentioned a bit of it earlier, but I would allow you follow through on that, Dr. Poi.
Okay, so annual health check starts from childhood. You know, right from childhood, you have to start your annual health check. So there's no particular time. But it's just that as you grow old, there are some other tests. Like if you're 20 years old, I don't think you have to be doing your PSA. So it's a prostate specific antigen. That's a test to check. There are some things, there are some chemicals that the prostate, as you grow older, the prostate releases some chemicals. So there are some tests that you're not expected to do as a younger person. But once you're in your 40s, you're in your 40s, you're in your 50s, all the tests that we outlined, you just have to go ahead and then just do all those tests. But just know that once you go to a good facility, something like AHA clinics or any other good facility, and you tell them you want to do your annual health check, they already know the right test that would be appropriate, for your age. So just go to a facility. Please avoid going to roadside labs and all that. The best is for you to go to a good facility, because some of these tests, they need to be done in standard quality labs, accredited labs, so that you have good results. Thank you. Over to you, Victor.
Thank you so much, Dr. Poyi. BBT, you have a question from one of our audience. They would like to know how you would convince a husband, father, or brother. It's related to what we've answered initially. Or a friend who has refused to see a doctor, even when everyone around them are concerned. Of course, maybe because they know that something is happening and all, or they probably suspect that something is happening and they've been pushing for this person to go see a doctor. So from your experience so far and being able to manage people at very high level and diverse level, what do you think you would tell this person to be able to convince them to get into the hospital? Over to you, BBT.
So we have to meet men where they are, not where we wish they were, right? Many men around won't respond to things around vulnerability. So if you're expecting ordinarily a man to show vulnerability, no, he would rather want to show strength. So men will respond to messages about performance, about responsibility, about longevity. So instead of, oh, take care of your health because you deserve it, you rather might say, take care of your health so that you can continue showing up for us. The man then sees it as, oh yeah, so my showing up then means a lot to these people. So that's one way. So maybe to change the narrative, rather than pressurizing the person to show vulnerability, turn it around and let it be why you need the person to continue showing up. So we need you to check yourself up so you can always be there for us. So the man will see it as, oh yeah, these people value what I'm doing. Yes, I'll do that. Another way, and I'll give personal example. I like sharing personal examples because that's one I have control over and I know full details. I'll share my example about myself and my dad. My dad is used to be the kind of person who will be, I'm fine, I'm not feeling any symptoms, so everything is okay, right? And when I became a lot more knowledgeable and married, having my own family, all I would do was invite him over. But I would have made arrangement for his health check before then. So when he comes, I'll accompany him there. Say, Daddy, let's go to this place and have a health check. In fact, there was a time when he followed me because I was going. And when he get there, I'm like, you also can have yours now, have your BP checked. So that would be another way. So don't change the message from go do it to, oh, I'm giving you this as a gift. Please, I'd like you to do this, right? And where you see the person not responding, as men, we always have friends that we listen to. You could also convince his friend, who are the company he works with. Imagine discussing, you want to get at me, or you want to get to me, rather, not get at me, you want to get to me. And you speak in a community of those that are Man U fans. I want to listen to them, because you are the best club in the universe, right? So when they say, oh, Man U fans, let's go for annual health check. Yeah, I'll listen to that. So look at what interests them. Who are the other men who those things interest, and you could go through them, to convince the men in your life to prioritize their health.
Thank you so much, BBT. That was clear, and in fact, we've really had this swell time. And unfortunately, this is coming to an end because we don't really have so much time. Someone is shouting "Glory, Glory, Man United" for you in the chat, BBT. Okay, so before we get our parting words from the discussants on this panel, I would like to tell all of us that just by being part of this particular session, EHA Clinics had made an offer to everyone who is taking part actively in this Father's Day activity, including what we just had now. You know, discount on our meal packages, right? So we have our men's wellness package in the clinic, which includes a comprehensive men's wellness check, which will be discounted. Would have up to 25% discount. That's a huge discount. So we'll have free dental consultation, free eye consultation for you. We'll have discounted toxicology test and discounted intravenous vitamins and nutrition therapy, which we also encourage as part of what men, not only women, could be doing. Our skin is also very important. We also need some of those vitamins, So comprehensive health care wellness package would definitely have gone for over a 200K before now. But of course, you'll be getting almost, if I be getting 50K discount, right? That's a lot of money on this particular package. So we also have our membership plans in EHA Clinics, which spans from standard to premium, right? So for our standard package, we would be giving 5% discount for new enrollments. It should have gone for 65,000, so it will be going for 61,700. Hence, sorry, for people that are part of this particular, session. And then for the standard renewal, we'll be having 10% discount for those renewing. For premium, the same thing, right? So 100,000 naira, you pay 95K for new enrollments and 90K for renewal, as against 100,000 respectively. So all these packages come with a lot of goodies, right? So we aim at having individual seeking for structured preventive health care, taking very good care of. It covers your annual health check for the year. It covers free consultation for the full year. And of course, it takes care of most of your routine screenings and prioritizes access to quality healthcare, which is the bane of everything that we do in EHA clinics, quality and safety for the patient. Right. So, sorry, we have just 2 minutes. I'll give our panelists time to give us their parting words. Dr. Derkat, can you use 30 seconds for your parting words, and we can move on to BBT.
All right. So as my parting was 30 seconds, please, if you have a smartwatch or you have your phones, aim for 7,500 steps at least 3 times a week as part of lifestyle modification. And then before you go, you start doing your 30 minutes exercise at least 5 days a week. Get that hobby. Look for a hobby, probably your childhood sports or anything that you used to do before. Kickstart that hobby. And then the last thing is try and get at least 6 to 8 hours of sleep every day. And then you can use your phone or smartwatches to track your sleep quality. Thank you.
Thank you so much. BBT, your parting words?
Yeah, for me, it's very simple. There's what you control, there's what you can influence, there's what is not within your control. What is within your control and what you can influence, take action, take step on it. You can control your diet, you can control your mobility, how you move around. You also can control your sleep, right? So take action on it. The ones you can influence it. You can influence what you spend time thinking about, what causes you anxiety, what causes you, what brings fear, to you. You can control it. What's not within your control, leave it out. You can't control where you come from. You can't control, the traits that comes from the family. But I tell you, if you control what you can control, you take action on what you can control, and then what you can influence, a lot of times it gives you, a better outcome on what you can control. So when it comes to health, apply this as well. And I think we'll be better off. Thank you.
Thank you so much, BBT. Thank you so much, Dr. Poi, for that. We are currently at 1300 hours, and we promise to not take so much of your time. Thank you so much to our wonderful audience. It's been a very good journey. Thank you for those who took our time to also ask us questions. Thank you for those who will definitely take the next step in taking themselves to where they're supposed to be health-wise. Men health really matter, right? So we're build stuff, yes, but we also need to build ourselves to live more. Thank you, everyone, and hope to see you when next we call. And thanks for joining. Bye.
Bye.